Welcome to the MS&Me Radio Network, a division of the Multiple Sclerosis Global Support Network. The following program broadcast is an original creation by the broadcast entity. Discussion within the following broadcast should be used for informational purposes only and is not a substitute for professional medical advice or consultation. Before considering application of any broadcast content in the following program, please consult your healthcare provider. If you feel you are having a medical emergency, please contact your local health services for immediate assistance. MS&Me Media and the Multiple Sclerosis Global Support Network do not guarantee or warrant the accuracy of information in the broadcast to follow. The Multiple Sclerosis Global Support Network provisions broadcast services to program hosts. Information discussed in the broadcast does not necessarily reflect the views, opinions, or goals of the network and are solely those of the show broadcast host. Should you wish to host a broadcast, please visit our website at msmemedia.com and submit a request to become a program host. We thank you for listening to the MS&Me Radio Network. Enjoy the show.
Hello, my name is Shirley Merritt, and I'd like to welcome you to my show. I call it Raspberry Lemonade, Let's Talk. First, I want to thank God for blessing me by bringing me to this forum once again. I also want to thank the staff of the MS&Me Radio Network for giving me this opportunity. My topic today is MS and bladder and bowel dysfunction. Bladder impairment affects 78 to 90% of patients, and bowel problems happen in about 68% of patients with multiple sclerosis. They are common symptoms that can be treated. Now I'm going to go over with you the ways that bladder function can be affected by MS. Just as other MS symptoms, the kinds of bladder problems vary from person to person and they can change over time. People may have trouble controlling the release of urine. That's called incontinence. They may experience a sense of having to go right away. That's called urgency. They may experience frequent urges to urinate. That's called frequency. They may have difficulty in starting to urinate or in sustaining a steady stream. That's called hesitancy. They may have the inability to empty the bladder completely. Now, some people experience urinary retention, and they require some form of catheterization. However, first, a urinary tract infection has to be eliminated as the cause before they'll do this catheterization. All of the symptoms that I just mentioned usually indicate that there is a problem in the functioning of the nerves controlling the muscles that control urination. Now, as far as urinary retention is concerned, you'll need to address this with your nurse practitioner. You'll provide a urine sample, which will be measured, and the specimen will be checked for a UTI, and that's done through laboratory urinalysis. Recommendations for treating bladder symptoms can be made after the initial assessment. But if this nurse practitioner finds that they're not able to help you with your bladder symptoms, or if you continue to experience frequent bladder infections, you may be referred to a urologist. The urologist specializes in the urinary system. The urologist can help evaluate the cause of the problem, and they may offer treatment options such as Botox or surgical interventions. Now, Botox blocks the neuromuscular conduction between the nerves and the muscles for short-term localized relaxation of the targeted muscle. I'll tell you how it works. Botox is injected into the bladder muscle to treat that overactive bladder and the symptoms. The symptoms that include strong urges to urinate with leakage or wetting accidents, and frequent urination when other types of medication don't work or cannot be taken. It is also used to treat incontinence in adults with a neurological condition, such as MS, who have small leakages or don't tolerate the side effects of other medication. Now, before Botox can be recommended, patients go under a set of tests to diagnose and understand the underlying problem. The tests are called urodynamics, and they provide computerized assessments of the overall bladder function. It measures if the bladder muscles contract involuntarily while the bladder is being filled, how much urine is left in the bladder after urinating, how much pressure exists inside of the bladder, and the bladder's capacity. Now, I'll tell you how Botox is administered for bladder dysfunction in MS patients. Here's what happens after the decision to use Botox treatment for bladder dysfunction is made. Before treatment, the urologist will instruct the patient about medicines that should be stopped. They'll recommend antibiotics that should be taken to prevent urinary tract infections, and they will explain that a catheter may be needed after treatment to drain the bladder completely. On the day of the treatment, the patient will be assessed for urinary tract infection, and the specialist will explain which type of anesthesia will be used. Then, Botox will be administered through small injections in the bladder wall. The procedure usually takes less than an hour. And after the treatment, the patient's blood pressure, pulse rate, and bladder emptying capabilities will be measured for about 30 minutes. The urologist will recommend antibiotics and check if urine is left in the bladder. And this is going to be done after you urinate within 2 weeks, and then again after treatment, and up to 12 weeks. Now, there are things that you have to be aware of with Botox. The effects of Botox may spread from the area of injection and produce symptoms that may last as long as some weeks after injection. Swallowing, speaking, and breathing difficulties can be life-threatening, and they can occur. Other serious adverse reactions that may affect areas not connected to the injection site could include loss of strength and overall muscle weakness, double vision, blurred vision, and drooping eyelids. You can have speaking problems, loss of bladder control, swallowing difficulties, and breathing problems. Now, I was given Botox once, but it was for muscle spasticity in my arm. My neurologist happened to be one of the few in the area that were, certified to administer Botox. So it did weaken my muscle tremendously. Now, if frequent urination is your issue, do not try to self-treat your bladder problems by drinking less fluid, because this can lead to constipation or urinary tract infections. Here are some bladder management tips. Adequate fluid intake is 1.5 to 2 quarts of fluid per day. And the urge to urinate comes about 1.5 to 2 hours after drinking something. Caffeine, aspartame, and alcohol are all bladder irritants. Smoking is also irritating to the bladder. Limiting fluid is harmful because you need to drink a required amount of fluid per day. It is not normal to leak urine, wake up more than once a night to urinate, or have infrequent urinary tract infections. Rather, frequent urinary tract infections. Bladder infections in people with MS may result in an increase in MS symptoms, spasticity, and fatigue. There are some important things that you should remember. You should drink fluids at once. Drink 6 to 8 ounces at a time. You know, if you sip all day long, you'll feel the urge to urinate more frequently. Try to go about 1.5 to 2 hours after you drink. Stop drinking fluids about 2 hours before bedtime. Urinate right before bedtime. If you tend to get frequent bladder infections, you're probably not emptying your bladder completely. Taking cranberry pills might keep your urine more acidic and decrease the bacteria in your urine. Now, there are ways that bowel function can be affected with MS. Bowel dysfunction is also a common symptom for MS patients. Now, the most common bowel complaint from a person with MS is constipation. However, the most distressing bowel complaint is probably that of involuntary bowel fecal incontinence. That's because MS interrupts or slows the transmission of signals to and from the brain, the electrical impulses to the muscles that are involved in emptying your bowel. They can also become disrupted. Now, depending on your particular bowel problem, I can give you helpful suggestions that can be made. These are some general tips for bowel dysfunction. As always, education about the causes of bowel dysfunction is key. So research and educate yourself to find out why this is happening. That's what I do. I research everything. I want to know why it's happening and what I can do to help prevent things and what I can do to make them better. So, as you know, as I will always be an advocate for educating yourself or doing extensive research. Okay, encourage dietary change to include more fiber and fluid in your diet. You know that fiber and water increases your chances of being regular. Consulting with your health care provider to adjust medication regimens that may be contributing to bowel dysfunction. Another tip is establishing a regular bowel routine, something that is individualized to the patient. For about a year, I kept a log so I could track how regular I was becoming. Because, see, all of my adult life, I was irregular, if not constipated. And now I had incorporated a better diet and a more sufficient water intake. And I wanted to ensure that I was effectively impacting my bowel schedule. I remember how encouraged I was when I could see my efforts paying off because I was becoming regular for the very first time of my life. So, all right, another tip is to add regular physical activity. A treadmill is good because, of course, walking is great. That's the best exercise for us. However, not all of us, can walk. I myself use a walker. What I do, it's no longer safe for me to use a treadmill. So what I do is I put the timer on the oven and I walk through my house. Because I use a walker, I have a long hallway from my bedroom to the end of the dining room. So I use my walker and I walk back and forth. And I set the timer for sometimes 30 minutes, sometimes 20, or however long you can, feel like you can do it. So I walk back and forth. And my dog loves it because she's a small dog and I can roll the ball from one end to the other and she runs after it. And so we're both getting our exercise. And yeah, that's the best exercise. Another great form of exercise is an elliptical. Because you're getting that motion of your legs moving, going up and down. And if you can keep that up for a good 15, 20, even 30 minutes, that's an extremely good form of exercise. You could do a stationary bike because at least you're moving your legs and your thigh muscles, your hamstrings, your glutes are getting a workout. Now, bladder and bowel symptoms are common in MS and can be effectively managed. If you need to speak with your health care provider about what you can do to help keep these symptoms under control, be sure to do so. And again, I'm going to reiterate, research and educate yourself on how to take control of your situation. I have learned what foods to eat that will enable me to have a daily bowel movement. If I eat kale salads with nuts, seeds, berries, fruit, and some crackers, I will be regular. So, I'm going to give you some bowel management tips. The goal is a comfortable bowel movement every day, either every day or every other day. Even every 2 to 3 days is good. For regular bowel movements, you need 1.5 to 2 quarts a day of fiber. I'm sorry, that's 1.5 to 2 quarts a day of water and 20 to 30 grams a day of fiber. And then, of course, some good activity. 1/3 of a cup of Fiber One or all brand buds. Those things can give you half of the fiber that you need for the day. Those are suggestions. Now, greasy foods, spicy foods, or food intolerances, for example, lactose intolerance, those may cause loose stools and may result in involuntary bowel movements. Now, some important things to remember. Eat regularly for regular bowel habits. Got to do something regular to get regular results. Plan a bowel movement for each day, about half hour after eating or drinking something warm. Now that doesn't usually happen for me. It might happen that night or in the middle of the night or the next morning. But it's aiming for a goal of daily is a good goal. Bowel activity is naturally increased by this time. Sit on the toilet for about 10 minutes and try to have a BM. There are certain things you can do to try to instigate this or get it going. You may want to rock back and forth gently on the toilet. If nothing happens, leave the bathroom and try again later. Now, you can also use a suppository to stimulate bowel activity. It takes about 20 minutes for a suppository to work. Occasionally, it might take milk of a magnesia or citrate of magnesia to stimulate bowel activity. It might help to take one of those. And it might take 2 to 3 months to establish a regular bowel movement regimen. Now, if you have these types of bladder and bowel problems, you may feel embarrassed at the thought of bringing them up to your doctor or your other healthcare provider, and that's understandable because these conditions can be physically and emotionally difficult to deal with. However, you shouldn't feel uncomfortable about talking to your healthcare provider because they're used to dealing with these issues and they can help you manage the problem. Besides, you're not the only patient they have who has these problems, right? So don't feel embarrassed. For the bladder and bowel to function correctly, certain nerves in your body need to control the right muscles, telling them when to contract and when to release to allow urine and feces to be eliminated when you want them to. This happens when the nerves in the spinal cord send messages from the brain to the bladder and sphincter muscles to control the flow of urine. The muscles must react. These are the muscles within the rectum and the anus. They help control your bowels, and the sphincter muscles control or release stool. Therefore, problems with bladder and bowel function may result from problems with nerve or muscle function. Well, because we have MS, we know that these messages are not being transmitted effectively, right? The important thing to know and remember is that these problems can be managed. It just takes a little bit of discipline. So, with that being said, people, it's the end of my show. And I hope that you've enjoyed my talk. And I hope that you will join me again next week. And I hope you have a wonderful week, a wonderful holiday. God bless. And we will see you again next time, okay? Goodbye for now.